Thanks, Chuck. Thank Nathan as well. And thank you all for being here. I know having an event like this in the middle of the week, you've had a long day probably in working, and maybe you just wanted to go home, but instead you came and joined us, and I really appreciate that. Can folks hear me at the back of the room? Good. With these high ceilings, sometimes your voice doesn't carry as much, but I think my wife, Catherine, will attest I'm a loudmouth. So it shouldn't be a problem for me. So with those kind words that came from Chuck and from Nathan earlier, I'd like to really talk about a kind of an innovative way to approach things, and we call that Medicare for employers. I started Health Perspectives about 3 years ago. I think Chuck mentioned that I left corporate America and started out my own firm, and I kept bumping into these organizations that are either directly or indirectly involved in Medicare. And I was on Medicare myself, so I was seeing it from the inside, and I really viewed that there was a tremendous opportunity and a strong vested interest among employers to really grab a hold of this concept called Medicare and see how it could be not only helpful for their employees who are over 65, but also helpful for the corporation as well. And that's really what we're here to talk about. So we'll start off by talking about what we call the healthcare squeeze. And many in this room are probably familiar with this competing tension that exists between trying to get a handle on these surging healthcare costs and meeting the healthcare needs of the employers. And those are both important, but they're really a tension between the two. You can't do both. You can do both, but your tension is always there between favoring one over the other. And it leads to expressions like this on the part of leaders in the industry. So this is what I hope that you'll take away from tonight's meeting. 4 takeaways. The first one, employers should care about Medicare and why they should care about Medicare. So we'll talk at length about that. Why Medicare is better for many people over the age of 65 than what they may have right now. What are some of the emerging trends that are happening today in 2025 that are going to have an impact on employees and employers, both in terms of being a threat and an opportunity? And then finally, how can Medicare for employers address those particular threats and opportunities? So that's the goal, that you'll walk out with that kind of information. So let's talk about those emerging trends. I've mentioned that a couple of different times. When you boil it down, there are 3 major trends. None of these should be a surprise to the people in the room. The first is employees are getting older. Why is that? Our society is getting older. The average age is going up. So employees are following that trend. Those employees are working longer. They're doing it for a wide variety of reasons, but there's a hidden reason that's now emerging that I'm going to expose tonight in this discussion. Medicare is getting better. For those that are familiar at all, you are much more fresh out of college than I am, so you're probably not on Medicare yourself, but maybe you've been working with parents or friends or whatever, and you understand some of the challenges of Medicare. Well, a lot of those challenges are being rectified quickly, and that's good news for people who are approaching 65. So a quick overview of Medicare itself, available to all Americans when they turn 65. It's interesting that many people have a misconception that Medicare is for people who are retired. That's not necessarily true. Medicare was formed for people over 65, whether they're working or retired. And so people have this misconception, I have to hold off, I have to wait until I'm retired before I can get onto Medicare. Not true. There are a lot of different components to it. People use the term Medicare, but many people fail to understand there's a lot of different components to it. There's the alphabet soup that's behind me. A is for hospital charges, B is for physician charges, C is for Medicare Advantage, D is prescription drug, and then Medicare Supplement covers what A and B don't cover. The right combination of that alphabet soup is going to vary from one person to another, and it really needs to take into what their needs are, their lifestyle, and needs some help to guide them along the way. Medicare options vary by county. So what's available to you here in Mecklenburg County is not available to you in Union County. And so people don't understand that. Now, it was done because the federal government, when they started with Medicare Advantage, understood that healthcare is local. The network of physicians, the hospitals, the other clinicians that are in there are going to vary from county to county. So they wanted to give that flexibility to have the right kind of plans operating given the demographics of that particular county, but that leads to complexities as well. There are many nuances about Medicare that have financial consequences. And this was an eye-opening experience for me when I joined. So when I started working with individual people on Medicare, I had a friend who, very bright guy, had been in healthcare for a long time. When he retired at the age of 65, he got Part A and Part B, but he didn't get Part D, which is prescription drug coverage. Why not? He wasn't on any drugs. So in his logical mind, why do I need coverage for something that doesn't apply to me? The problem with that is he got older and he had a need for drugs. And he went to apply to get prescription drug coverage. Well, he learned that he was going to have to pay a late penalty. And that late penalty was going to be with him for the rest of his life. So you have a couple of late penalties that everyone should be aware of. Part B and Part D are those traps, those financial traps, unless you know what is the right timing to get both those coverages. All of the above leaves many who are 65 confused, overwhelmed, and lost. And many of them work for you. So let's talk about why employers should care about Medicare. There are three key reasons. This is the first one. It can be better for the employee or for the dependent that's over 65. It depends upon their situation, but in general, it can be better for two reasons. Better coverage. So if you're a business leader and you're concerned about your company and your employees, when you try to find a group health plan for your company, you really need to think about all of the people affected by that group health plan. And it's not just your employees, it's the dependents as well. So when you think about the age span, if I put out my arms, it's from people my age on one end and newborns at the other end, and everyone in between. So the employer has a great challenge of how do I do all things for all people? It's not an easy thing to do. Well, Medicare doesn't have that problem. They're not worrying too much about pediatric care and NICU days and pregnancies and various other maternity-related costs and issues. They can focus just on the other end of the spectrum. And as a result, they actually do things in the Medicare population, particularly in Medicare Advantage, that the group health plan doesn't even think about doing. And we'll talk a little bit more about that as we go along. It's also better in terms of the costs. So when you think about it, if you can just focus on a segment of the population, you don't have to worry about those NICU days, that's going to provide some cost relief. Also, all of us in this room and the employers we represent have been paying for Medicare for as long as we've been working. When you started working, you were paying a Medicare payroll tax. And so you've been funding Medicare all the way. So that's taken into account when it comes time for you to join Medicare many years later. And then last but not least is the unleashing of Medicare's buying power. You may be aware that just recently, Medicare has the green light to negotiate directly with prescription drug manufacturers. So what does that mean? I'll put it in practical terms. You may be familiar with a drug called Eliquis. It's a cardiology medication, very important, very needed, but very expensive. The list price for a 30-day supply of Eliquis right now is $590. Next year, it'll be $260. Why? Because Medicare can negotiate now. Up until now, they haven't been able to do that. So that's one of those macro trends that's happening that's going to have an impact. So don't take my word for it. Let's look at a survey that was done in 2023 by the Kaiser Family Foundation. They interviewed 3,600 Americans and asked them what their impression was of the insurance that they had. All different types of insurance, Medicaid, group health plan, Medicare, a variety of different types. And here's what they found out. When they looked at the overall performance of that current insurance, here's the results comparing Medicare and employer-sponsored care. The people on Medicare like Medicare a lot better than the group health plan. Again, the group health plan is trying to do all things to all people. It's not easy to do that, whereas Medicare can focus on just a segment of the population. So I'd like to introduce you to actually something that Nathan was talking about earlier, and that is primary care that's solely for Medicare enrollees. We all have the negative experience of going into a physician's office sitting in a waiting room, sitting in the waiting room some more, and being surrounded by all sorts of other people that are in the same situation. Well, again, if you can segment the population and only serving one, it changes the whole customer experience when it comes to Medicare. And I'm going to give you an example, which is Archwell. That's Nason's company. Now, there are several others. Centerwell is another company that does very much what Archwell does, and ChenMed, Iora, Oak Street. These are all relatively new organizations that are growing up because what they're doing is changing the nature of healthcare delivery to seniors. But if you're under 65, don't bother going. You're not eligible. It's only for Medicare because they want to focus on the Medicare population, do right by them. So let's take a look at what it looks like. So this is a picture I grabbed off the internet. This is a waiting room, except it's not really a waiting room because people don't wait. You have an appointment, you go back. You register, you get back very quickly. But what you can't see here are some interesting things. On the left-hand side is the community room. What happens in the community room? Well, it depends on the day and the hour. It could be that there's a Zumba class going on in the community room because Zumba is good for your balance. And seniors have a tendency to fall, and when they fall and they break a hip, that leads to problems. So it could be Zumba or Tai Chi. It could be a computer skills class in the afternoon because loneliness is an issue for people that are Medicare and maybe have not the mobility that they used to have. So if we can teach them computer skills, they can interact with their family who may be 3 states away. So that community room is very highly used. Off to the right, there are tables, people playing cards. They didn't have an appointment. They come in to play cards with their friends. This is a community center that's masquerading as a medical center because community is really important to people who are older and maybe their family lives far from them. So this becomes their community center. This is that community room. It looks like it's set up for a computer skills class or something like that. So it provides a lot of additional services that you don't normally expect when you go to a doctor's office. All right, reason number 2 why employers should care about Medicare. It's growing. This population, as we talked a little bit before about the macro trends, is growing. It's growing very quickly. So these numbers that I'm about to give you come from the U.S. Department of Labor. And we look at 2022, about 7% on average of a given workforce in the United States had 7% of the people were over the age of 65. In 2025, the year we're in right now, it's crept up. It's now at roughly 0.5% higher. But let's look at 2030. It's about to jump big time. So almost 10% of the workforce is going to be over the age of 65. So now it's becoming more important for employers to think about this population that's still working, probably very valuable employees, but also very expensive employees as well from a healthcare standpoint. So what's driving this increase towards 10%? Well, there are a number of reasons, but one that may not be fully appreciated is something we call the Social Security gap. And I'm going to explain what that is by using this chart. So on the far left-hand side, you'll see years listed there, and that represents when a person turned 65. The second column is when they became eligible for Medicare. It's always been 65. You can see a consistent number there. But that's not true for Social Security. It used to be 65, but you can see that's changed. And then on the far right is the gap between Medicare and Social Security. Prior to 2008, if you walked off the shop floor or out of that office building for the last time because you had just turned 65, you left being assured that I've got my coverage for healthcare, Medicare, and I've got full employment, Social Security income. I'm in good shape. Well, Congress figured out that Social Security was losing money and couldn't keep up with this. So back in 2008, they said, you know what, we're going to push out that full retirement income on Social Security for a year. They did it all at once. So from 2008 to 2019, you had to wait a year. So now people are thinking, well, maybe I should work a little bit longer because I want to get that full retirement income. Well, we got to 2019 and Congress said, we're still losing money out of Social Security. So we need to do something. But now we're going to push it out, but we're going to do it in a phased approach. We're going to do it over 6 years. So this year, 2025, is now a 2-year gap. So people are going to be working longer because, yeah, I got my Medicare coverage, but I'm not going to get my income that I was counting on because we got pushed out. There's no talk in Washington of changing the Medicare number, 65, but Social Security is still struggling. So I wouldn't be surprised if it's going to go beyond 2-year gap. It's going to be more than that in the future. So what does that mean for employers? Well, it's a threat, because now you've got more high-cost people that are working longer in order to achieve that full retirement age, and that's going to have a negative impact on your budget, particularly as it grows to 10% of your population. But there's an opportunity, and the opportunity is if those employees decided, you know what, I think Medicare is actually better for me than the group health plan, then you may be able to keep these really valuable employees, but lose the cost of having those employees when it comes to healthcare. They may just go to Medicare, and you've got the best of both worlds. Valuable employees, I don't have their healthcare costs. So reason number 3, as I mentioned before, this population is very expensive. How expensive? Oh, about 2.5 times more expensive. When you look at the annual healthcare expenditures for people over the age of 65 in our country, it's about 2.5 times what the cost is for the working age population between 19 and 64. So what does that mean? Well, what that means is by 2030, you're going to have 10% of your population that's causing you 20% of your healthcare budget. That's a huge number. And so steps have to be taken to address this one way or another, because there's a tidal wave that's happening and it's not going to be stopped. So what's the solution? What's Medicare for employers? Well, we believe there's an approach here that can help bridge this gap and reduce the healthcare budget. And there are 2 components to it. There's the corporate Medicare game plan. That's the macro approach to what's unique about this company, and therefore what approach should be taken to address the issue that we've just been talking about. The Medicare advisory services, that's the micro perspective. That's working with one-to-one with people who are approaching 65 or already there. What's best for them? What's the right plan? Because remember, they're feeling overwhelmed and confused and lost, and they need some professional guidance to do that. So let's go a little bit deeper into the corporate Medicare plan. It starts with a corporate analysis. What's unique about this company? What's the culture like? What's their strategy in terms of attraction and retention, particularly when it comes to older personnel? What are their profiles? Where do they live? As I mentioned, county by county is going to be different in terms of the solution. So you have to know where your people live. What are their profiles? What's the claims history like for the older population? That translates into a written game plan, a corporate Medicare game plan on how the uniqueness of this company can address the issue that's associated with that population over the age of 65. It then converts into group-level information, Medicare 101 webinars and meetings, communication materials that are massively distributed, educating, informing, getting people comfortable with the concept of, got other options here now beyond the group health plan. There's a one-time fee paid for the employer by the employer for that part of the game plan. So then you have the individual analysis, the personal analysis. What's important to them? What's their lifestyle like? Do they travel a lot? What kind of issues are they grappling with? Very personal information to figure out what is the right solution. It could be to stay on the group health plan, or it could be to go to one of the Medicare options. And so part of that discussion is comparing coverage options between what is your group health plan now and here are some Medicare options that might be a good fit for you. And that support is ongoing. Even after they leave the employer, that support from a licensed Medicare advisor is there for them at all times. And it doesn't cost them a dime. It doesn't cost the employer a dime. The compensation from that comes from the medical insurance carriers. So let's talk about some of those components. So I mentioned it started with a corporate Medicare status review. So that's going to produce, here's how many people you have that are over 65 now. Here's what plans they're on now. Here's how many dependents are over 65. What plans are they on right now? And who are the people coming in right behind them? Who's 63, 64 years old that are coming? Because it doesn't start when you turn 65. You need to start thinking about it before then. Then there's that high-level overview of comparing the group health plan to Medicare options, a claims analysis report. Here's how much this group is costing you, Mr. Employer or Ms. Employer. And that leads to, here's the projected and potential impact financially of introducing Medicare as a viable option for people. When I left corporate America, I had just turned 65, and I made two mistakes. Number one, I assumed that my coverage in the group health plan was better than Medicare. I was wrong. I was on a high deductible plan, and boy, I reached that high deductible level. And then I'll talk about a comparison between the two as we go along here. The second was that, well, it's got to be cheaper. It's got to be less expensive because after all, my employer is paying 75% of the premium. Well, that was true, but that's not your total cost. Then you have the deductible and coinsurance and copays beyond that. And so when you add all of that, I would have saved $1,000 a year if I had gone to Medicare when I was 65. My employer said nothing to me. Didn't even remind me that I had this other options that were out there, and I made two bad assumptions along the way. We'll make communication recommendations. This is really important because you don't want your 65 and plus employees feel like you're pushing them off the group health plan. You can't do that. So it has to be portrayed as, hey, you've got everything you've always had. You still have that group health plan, and if you want to stay there, God bless you, you can do that. But you should be aware of all of these other options that are there that may be a better fit for you. So communication is key. And then there's that attraction and retention strategy. How does that change things if you know that I can keep these older employees who are really valuable and they do a good job, but lose their healthcare costs? How does that change your attraction and retention strategy? So I'm going to give you an example here. I'm going to create a scenario and make some assumptions. I'm assuming that there are 500 employees, and with that size, they're probably self-insured. I'm assuming that this company follows the national averages when it comes to what portion of the workforce is over 65. It starts with 7.4% in 2025 and grows to 2030 to almost 10%. I'm also assuming that roughly half of those people are going to have a spouse that's also on the group health plan. The second to last assumption is that I'm going to assume that starting in 2025, when properly informed and educated, that about 25% of those that are eligible will move over to Medicare. But that number will grow because remember, these people are still working there. And if they're still working at this company, they're now starting to tell their friends about, you know what, Medicare is a pretty good deal. And that percentage will grow over time. And then finally, I'm going to use national statistics in terms of what is the employer's cost when it comes to people that are over the age of 65. So with that being the assumptions, let's take a look at what that means. This year, 2025, there's the 500. At 7.4% of that population, that's 37 people over the age of 65. But half of them have spouses that are also over 65. So if you add those, we're now talking about 56 lives. Well, if 25% of those switch to Medicare, that's about 14. And if the employer cost per 65 plus life is $15,000, potentially you're talking about saving $212,000. Well, what happens in 2030? Remember, you've got this trend that's moving up from 7.4%, closing in on 10%. Well, now that same 500 employees, now there are 48 people that are over 65. Half of them have spouses that are over 65, so now we're talking about 72 people. If there are now 35% of the people making the switch because they've been hearing great things from their coworkers, and if $19,000 is the number with a 5% inflation trend, now you're talking about $500,000 that goes to your bottom line. So my friend Todd, he's a CFO. And so when I talked about some of these things, about all the great benefits potentially of Medicare for employers, he goes, sounds good, John, but there's no perfect solution. There's got to be risks in there somewhere. And so he said, your credibility is at risk if you don't talk about risks. So thank you, Todd. If you know Todd, this is so Todd. So the risk mitigation. So there are really 5 different types of risks. This is a legal risk. Again, if you're perceived as pushing people off the group health plan, that's going to lead to legal problems. So you don't want to do that. So all communications have to make a clear statement of, you can stay on the group health plan. This is just an additional option. The other risk is cultural. What if some of the younger people are ticked off because it looks like they're getting more benefits over the age of 65? Well, it's true, but those benefits aren't being provided by the employer. They're provided by the federal government, and all Americans get those. So it's really not the employer providing the benefits, it's the federal government that's doing that. The investment risk. Well, you're assuming 25% here, John. What if we don't get 25%? Well, as I mentioned, there's a one-time fee. That one-time fee is going to be less than one person moving from the employer to Medicare. And if that's still too much of a risk, we'll talk about maybe having a shared savings where you pay less up front and there's savings on the back end. And there's no doubt what those savings are, because you're going to know exactly what you're paying for that person in 2025, and when they left in 2026, it's zero. There's your savings. There's no doubt what it is. Data breach. That's a concern for all employers, all parts of our society. Well, although the information is collected locally when you're doing those one-on-one conversations, it doesn't stay locally. It actually goes into a platform, a nationwide platform that has direct relationships with health insurance carriers. And believe me, data security is huge for those carriers. So you have to be HIPAA adherent in order to be able to work with that platform, and that's where the security lies, on the platform that works with the insurance carriers. But probably the biggest risk is doing nothing. We know that tsunami is coming, that many more people over 65 are going to be in part of the workforce. We know that they're very much more expensive than the rest of the population. If you don't do anything, you're going to have a real struggle with your healthcare budget, and that's why we think you should consider Medicare for employers. All right, so a quick summary slide. Medicare, in many cases, offers better coverage for the employee and does it for an employee segment that is growing rapidly. It's a very expensive population. But when the solution works, there's an immediate impact. When that person decides, okay, I'm leaving and I'm going to Medicare, that cost is gone. So therefore, it reduces your healthcare budget, and it does it with a very modest investment on the part of the employer, because part of the cost of being covered by the Medicare insurance carriers, and part of it is going to be risk sharing that you only pay if it works. Let Medicare fund part of your healthcare budget. All right, so I'm open for questions. I have a couple of slides after that, but I've thrown a lot of information at you, and now's your time to pepper me with questions. So, Jason.
Great job on
Thank you, Jason.
So, John, my question is this. This is a compelling case for employers to focus on both the threat and the opportunity. Why shouldn't employers take advantage of this?
Great question. One of the reasons may be that they think, I don't have that many people over 65, so why should I spend my time on that? Well, again, it doesn't take a lot of employees, particularly if they have spouses that are over 65, to make a dent on your budget. And the cost is minimal. One person moves, you cover the cost. So yeah, you have more of an incentive if you have a lot of people that are approaching 65 or over 65. But even for smaller organizations that only have a handful of people that are in that 65 age range, you're still going to have a great benefit, and that benefit is going to increase over time. Okay, go ahead, Shay.
Okay, so don't check my math, Mr. Sterling. But, okay, so say me and my spouse are 65 years old,
Yeah.
and I am paying, my employer's great, they're paying 75% of my health care. I'm now paying like $5,000-6,000 a year. Mm-hmm. What's the difference between what I'm going to pay out of pocket versus going on all of the alphabets that I need for Medicare?
Yeah, so there are two channels that you go down when you're considering Medicare. One is called traditional Medicare. The other one's Medicare Advantage that Nason was talking about earlier. And so traditional Medicare, most often at first blush, is going to be more expensive than Medicare Advantage, but you have unlimited choice. You can pretty much go to any provider in the United States, they accept Medicare. About 98% of providers do that. But you're probably going to be, if you want complete coverage, you're talking about A, B, D, and a Medicare supplement. When you include all of those, that's what I had when I first started Medicare. And as I said earlier, I still would have been paying $1,000 less than I would have been on the group health plan. That's for traditional Medicare. Now, Medicare Advantage offers another opportunity. And there are some Medicare Advantage plans that are $0 premium. So pretty enticing. There are some constraints, though. You may have a very limited network. So it could be that there's a network that's right here in the greater Charlotte area, and God forbid that you develop a significant illness, you may want to go to a doctor in New York City or Chicago or wherever. That's going to be difficult to do. So you have much broader coverage under traditional Medicare, much more narrow under Medicare Advantage, but you're getting a lot more benefits within that network, like what I was talking about before, and certainly financially it's great. So you're talking about risk. What's your stomach for risk? If you think you're going to be healthy, then you're probably better off on a Medicare Advantage plan. But we all age. So eventually you want to have more coverage. I think, was it Elizabeth that had a question? Do you have a question?
I did. I just wanted to ask you, when you look at the example you gave that was for a self-insured company, what do the numbers look if it's not a self-insured?
Okay, yeah. So smaller companies, especially when you get down below 200 or 100 people, they're more than likely to be fully insured. There's still a financial benefit, but it's a different kind of financial benefit. When you're self-insured, when that change happens, when someone moves to Medicare, immediately you feel the effect of it. If you're a community-rated plan that's fully insured, you're not going to see it right away. There's going to be a lag time before you actually see it, but you will see the number of lives change, and that has a benefit right away. So you're typically paying for a fully insured product, you're paying based upon, well, how many folks do we have in this company? Well, if 25% of the older people leave, then you've got a smaller head count.
Hey, John, can I add something too?
Sure.
For fully insured product, if you're 100 plus, right? So you have that person leave. That person, what John's been talking about, is fair, the average cost of that person. The reality is there are a lot of people that fall in that category that aren't the average cost. And if you have one of those people on your plan that are fully insured and they leave, your rate next year is going to be dramatically impacted by the fact that person left versus that person staying on.
Yeah, great point. Thank you. Other questions, comments? Yeah, go ahead.
In the weeds. So on the one side, you talked about there's a fee for the general, like employer, education, all of those pieces. And then
Right.
on the right, you talked about the individuals.
Yeah.
And you said that those fees are covered by Medicare.
By the health insurance carriers that are offering Medicare, yes.
Okay. Is that at any age? Like, at what age would that be covered, or is it not covered until they're 64 or 65?
It's 65. So yeah, it is 65. So all of Medicare, whether it be traditional Medicare or Medicare Advantage, starts at 65 for virtually everyone. Now, there are some exceptions. You can be on Medicare because you have certain disabilities. So there are some exceptions to that. But apart from that, the clock starts ticking at 65 when you turn 65.
So is there an option to direct pay for those individuals who are 63, 64, where that meeting would be helpful and they are not yet eligible?
Absolutely, absolutely. When I talk to the employer about these people that aren't quite there, but they're heading in that direction, absolutely would have discussions both at a group level and at an individual level, even though they can't actually get into Medicare until the following year or something like that. Yes, absolutely. You bet. Yeah, thanks, Sharon. Others? Did someone over here? Any other? Go ahead, Todd.
So, John, I'm not sure if you researched this one, but I have several clients that are extremely generous with their health benefits to their employees, excessively generous. how does that transition to Medicare? How can the employer continue to be generous with the employee when the employer is no longer providing the coverage?
Yeah, I hear what you're saying. So I'm going to make sure that I understand what you're saying. I'm going to repeat your question. So these folks have been treating their people very well, very generously when it comes. It may be 100% coverage or something like that.
No out-of-pocket health care.
Right. And if they move to Medicare, there may be some costs associated with that. So are you asking if they can provide some sort of a bridge or a kicker or something like that? That's one that really gets down into the details. The devil's in the details on this one. Because again, you can't be favoring certain people. And if you're providing some sort of an incentive for the people that are 65, then the people under 65 are going to have a legitimate gripe. Hey, you're paying these people extra money. So this is where, I'm not a lawyer, but this is where you would need to have some legal counsel to help with that.
Folks over there.
There's a scenario where the company offers everybody a $5,000 HSA, and that HSA can be used for your high deductible plan for your people under 65, but the people that are over 65 on Medicare, that same $5,000 FSA is in place. I mean, I'm putting it out there for an idea.
Yep, yeah. Elizabeth knows. She's not a lawyer, but she sounds like one.
This is, I don't want to wade too deep in that space, because I don't know the nuanced differences between FFA and income contribution. But let's go on Medicare, it's separate than our margin, cannot contribute to the thing.
So then, feed through HRA, healthcare reimbursement.
That I don't know.
Yeah, but
If the employer is trying to be generous, they can contribute to that HSA as much as they want, and the employee can continue to use it. They just cannot contribute to it, but they can continue
Right.
to use it and then take it with them when they're beyond.
That's right. That's a good point, Sharon. Thank you for bringing that up. Okay. I've got a couple of other slides, but I don't want to stifle any questions. Any other questions? Go ahead, Nathan.
Yeah, John, this is a question that maybe in the weeds a little bit, but how do you navigate around companies that do have some affiliation with these large national brokerage houses like Aon that help provide benefits that also bleed over into this healthcare space? They might be touch and feel.
I'll let Shannon answer this question. So what we're talking about, I'm repeating your question, is sounds great, but when you have these national consulting firms like Mercer and Aon and Willis Towers Watson and so forth, how do they handle something like this? Is that what your question is?
Well, yeah, in a way, they're already in place with the company.
Right.
And you're limited on these services.
Sure.
And they've got brokers they work with.
Yeah.
Ancillary services.
There's certainly some overlap between some of the services they provide and what I presented here, but I think the difference is that macro-micro combination where, yeah, you want to talk to the employer about what's unique about this employer and how we're going to address this issue, but you're also having the same conversations one-on-one with people. So that's one of the big differences, I think, than what you would see, but I'm going to ask my friend Shannon to talk about that.
Well, I apologize, I don't do this on the human side.
Yeah, right there. That.
It varies greatly in terms of how different agencies play in this space. So I think the first thing I would tell you is you probably ought to ask your consultant you're working with. Typically what you see is that consultants going to work with companies like John's to say, hey, this is a great solution for you, you may want to look at this. And frankly, to vet out, be agnostic in that space. For the most part, I mean, you have some agencies that make that in-house and have their own solution. But I agree with John, the piece that I don't see a lot of is, you see it from a individual consulting perspective with the employee. You don't necessarily see it from an organizational perspective, looking at, as an organization, how should we be approaching our strategy on this. It's more just come and educate our people on this. That's the big difference I see.
Devil is in the details, so it depends what is in your contract with that provider. Even if you're talking about an AM or a Mercer who offers those services, if you don't pay for those services, you will not get them.
That's right.
So I think it's really important to understand what they offer you, and then I think it's making the decision about whether, when you renegotiate that contract, you want them to do it or somebody else, and you can look at what they would bring out for that price.
Right, thanks. Great. I saw another hand. Anyone else?
Can you just touch on that employer fee piece? I mean,
Yeah.
just, I want to understand that a little better.
Sure. Yeah, obviously, the larger the employer, the more complex the situation. So the fee is graded depending upon the size of the employer. And as I mentioned, you can either pay one lump sum at the beginning for that work, that game plan that we would produce, or you can pay a lower amount and then, have a shared risk arrangement on the back end when things start to happen. But even if you pay the full upfront fee, it's less than one person moving over.
So that's a fee for your services.
That's right. It would be paid to Health Perspectives to develop that game plan.
Thank you.
And then the other fees would be paid to us, but coming from the medical insurance carriers. Right.
Thank you.
Okay. Last slide. So my contact information. I showed you that example of the financial impact for that fictitious 500 employee organization. Well, if you want to apply that to your own situation, how many 65 plus employees you have, how many total employees, maybe you know the cost for those people over 65, you can use that QR code. You can do it right now if you wanted to. You can go there. It'll bring you to our website, direct you to the cost calculator. You plug in your own numbers. You will see the impact potentially there. So don't hesitate to use that. All right. Any other questions before we get to the beer and the wine and so forth?
Someone
Can I make a comment?
Sure.
I don't know how many, has everybody here worked with you directly?
Not everyone, no.
Okay, if you have not, John has proven over the years to be incredibly creative in trying to find solutions in difficult situations. He is very honest and forthcoming, and it's also, Johnny on the spot. You need him, he will respond. So if you have not worked with him, I highly recommend it.
Well, I didn't pay her to say that. I promise. I did not pay her. No. All right. Thank you again so much for coming.